trigeminal neuralgia, or have you been even diagnosed with trigeminal neuralgia? I just want to take a few minutes to just give a very broad overview, right? There are two types of trigeminal neuralgia. Type 1 is the more classic, very sharp, intense, shooting, lancinating nerve pain, usually unilateral, one side of the face that can occur. Then there's type 2, which maybe it's more of a constant, dull, stabbing, aching discomfort that can last for several hours. And sometimes people can have a little bit of combination of both. This can tend to affect women a little bit more than men, and usually around the age of 50 or older. So obviously, if you've been given that diagnosis, certainly there are some things to rule out. It is possible that it could be an indication of multiple sclerosis, MS. God forbid, any potential for a tumor or something like that. But in many instances, those types of things are vetted and ruled to be negative. So now you're left with, what are my options? How do I treat this? And from a physical therapy perspective, there are certainly some things that we can do, at least in my personal experience and our company's experience at Freedom Physical Therapy. Oftentimes I find that trigeminal neuralgia is a culmination of several different factors that can create this problem. So just a brief anatomy, so the trigeminal nerve is one of 12 cranial nerve. It's the fifth cranial nerve. When it's irritated, it can cause symptoms kind of in the forehead or upper facial area, up and through here, the maxillary area, or the more common one tends to be in the mandibular area, the lower side of the cheek and chin area, especially when it comes to trigeminal neuralgia. The trigeminal nerve actually comes from the base of the brainstem, right? So deep underneath the floor of our skull, and it can emerge. A lot of the nerve tissue comes through the base or floor of the skull. Some of the more common ones, at least from a temporomandibular disorder that we tend to look and check for, one would be the arculotemporal nerve, which is a portion of the trigeminal nerve, or a portion of the mandibular nerve. And the auriculotemporal nerve sort of wraps around actually the condylar head of the temporomandibular joint. So oftentimes for people that might have sensitivity and pain in that area, some simple things I look for could be maybe they wear glasses and their frames are too tight and putting constant pressure through this area and irritating that nerve. Another potential could be the masks. The mask wearing we've had to endure for a couple years prior, post-COVID, depending the tension and the tightness. And another thing I often think about is, right, with people with sleep-related issues, CPAP. And depending on the design and what someone is wearing, those can be very tight and restrictive and be putting pressure on some sensitive nerve structures. So those are what I call kind of the low-hanging fruit things that I like to look for. But also, where the trigeminal nerve resides in the brainstem, at least 3 of our upper cervical nerves, C1, C2, and C3, but really all the way down to C5, also reside in that brainstem area. So you also have to be really good at assessing the upper cervical spine. So my point is, we try to tease out different factors and markers that can contribute to this overall sensitization of the trigeminal nerve, which is causing this very unpleasant, right, and very painful experience for people. Another factor to think about certainly is tooth. Now, tooth-related issues. Certainly, if you do have trigeminal neuralgia, not uncommon to have tooth pain, and the dentist has probably done a good job maybe vetting that it isn't tooth-related. But I have to tell you, in my clinical experience, too often, I do find people have, and I have a very rudimentary way that I assess for tooth-related pain. And if when I sort of stress the teeth in certain positions and areas, and I can replicate that pain that's familiar to them, oftentimes it's important to get them back to the primary dentist or maybe an endodontist to really do a thorough assessment of that tooth and see if I can eliminate that situation. Because one of the other branches of that mandibular nerve, which is again a portion of the trigeminal nerve, is the inferior alveolar nerve, which actually goes through the bone of the mandible. So anytime there's some tooth-related situation, or possibly you've had an implant, and now all of a sudden that implant might be irritating that nerve. So again, lots of things and factors to consider. There's also another nerve called the lingual, but that's more on the inside So those are just some things to consider that could be contributors to this diagnosis. And the other thing that often I feel gets overmissed is many patients suffer from cold sores, right? Herpes simplex, cold sores, oral sores in the mouth, in the gum area. And usually one of the questions I ask is, do you notice a pattern to your symptoms? Because sometimes people have frequent outbreaks as often as every 3 weeks. And when that virus becomes active, that will definitely agitate and irritate the trigeminal nucleus and that trigeminal nerve system. So those people I tend to find, once we determine that that is part of the problem, respond very well to some of the antiviral medications that are out there. And it can actually eliminate it, not cure it, but as long as you take the medication, knock the relapses of that virus down significantly. And again, all of these subtle factors can have a profound impact on the sensitization of that trigeminal nerve complex and hopefully avoid any significant surgery like gamma knife surgery or microvascular decompression or those types of things. And then the final thing just to talk about is obviously, right, one of my fortes that I love is the temporomandibular joint. So not uncommon, people can also have some underlying temporomandibular joint disorder going on in this crazy little joint here that can once again sensitize that trigeminal nerve system and all be a contributor to the diagnosis or potential diagnosis of trigeminal neuralgia. So I hope you find this a little bit helpful. There are some great things that we can do in the physical therapy realm to try to help downregulate that sensitive or sensitized trigeminal nerve. Not always necessarily a cure, right? But reduce the symptoms 75-80% for most people. That is a win. And they're very happy and continue to live and function very well. So it's unfortunate if you have been diagnosed with this and you're on this journey, but continue to search and see if you can find a really skilled physical therapist that has the knowledge and the certification in treating temporomandibular disorders, but also a really good understanding of cranial nerve anatomy and the upper cervical spine.